It is what some call an invisible illness, but for those who suffer from endometriosis, the effects are very real. March is Endometriosis Awareness Month, and although the condition affects millions of women worldwide, those who suffer from it say it's often still misunderstood and misdiagnosed. In a moment, we will be hearing from a doctor, but first, Kristina Kasparian is a Montrealer with endometriosis. She also created an online community for people with endometriosis called Alba A New Dawn. And she is on the line this morning from the Plateau. Kristina, good morning. Welcome to Daybreak.
Good morning, Sean. Thanks for having me on.
Tell me about endometriosis. What exactly is happening if you have it?
Yeah, okay, so endometriosis is a really complex, common, and like you said, misunderstood medical condition. It's a condition where tissue that's similar to the lining of the uterus grows in other places of the body, so on organs, ligaments, nerves, and spaces between them. And this can happen even outside of the pelvis. So it's often described as a painful period disease, but it's really much more than that because these tissues can cause inflammation and scar tissue and bleeding, and it could lead to organ dysfunction and infertility in many cases. So it's really a whole body disease. It's a systemic disease that can really affect a patient from head to toe and have a huge toll on their mental health and their quality of life.
Yeah, I bet. When did you realize something was wrong? Did you even know what it was at first when you did realize something was wrong?
No, that's a really good question. I actually don't even remember a time where I felt like it's hard to picture when I felt normal. I think I don't even remember a time without pain. So chronic pain, pelvic pain is really the hallmark symptom, not only during periods, but like throughout the whole cycle. And I think what I did realize was that my normal wasn't shared by my friends or by my peers. And I started reading up on it on my own, and that's when I started to demand better health care because it started in my teens. Like the most common symptom was just severe pelvic pain, severe period pain. I was a little embarrassed because my periods were so heavy that I would stain through my clothes or my sheets at night, and I was confused. I didn't know who to talk to. But then as the years went on, the symptoms just became more severe and more widespread. So I started having intestinal issues, bladder issues, food sensitivities, and every time I ended up in the ER, they just said, "Oh, it's anxiety." I was in grad school at the time, so it was always associated with stress or that I had irritable bowel syndrome or bladder infections. And then the more I started reading about endometriosis, I realized, okay, there's something else going on. And at one point, the symptoms got so bad, like I couldn't breathe, I couldn't project my voice because it was growing on my diaphragm. I couldn't shower without needing to lie down. I couldn't bend over to pick up anything off the floor, like go over bumps in the car. So it was affecting me from morning till night. And I must have seen over 10 doctors, and no one would do an MRI. They would just do an ultrasound and always say that everything was normal because they weren't trained to look for it. And it doesn't actually show up, like deep endometriosis doesn't necessarily show up on ultrasound. So you really have to go in with surgery.
So how long did it take for you to finally get a diagnosis?
An official diagnosis took between 16 to 18 years from the onset, from the first time I really started to seek care. So I had to go to Toronto for surgery because nobody would accept to do it here. When I asked doctors, specifically gynecologists, they said that I should get pregnant because that was the easiest way to solve the issue because pregnancy hormones they don't treat the illness. They just dampen the symptoms for a little bit, and they thought this was an adequate solution to propose to someone, which is really detrimental and a bit damaging, honestly. So when I went to Toronto for my first surgery, out of 3, they removed the disease from all organs, like between the rib cage and the bottom of the pelvis. And then I realized that we spent so long fighting for a diagnosis that there's a whole other road after that where you remove the disease, but that's not what healing is. You have to relearn how to move, how to breathe. Your organs have been stuck together for so long that you've had so much inflammation and chronic pain that you really just have to rewire everything, your brain, and just start over. And often that's really minimized.
What was it like to have someone finally say, after 16 to 18 years, say, this is what is happening to you?
Yeah, honestly, I remember waking up from surgery and being afraid that I had imagined it and that all the doctors were right, that it was anxiety, that there was nothing there. And when the surgeon said, I remember I said, was it endo? And he said, oh, yeah. And I said, where? He said, everywhere. And it felt like such a relief, which is a really odd thing to feel because endo doesn't have a cure. So basically you're feeling relieved in the face of an incurable illness, which is a really odd reaction. But to have that validation and to have that after so long. The only problem was even after I got my diagnosis, it was still questioned back in Montreal. So whenever I asked for pain management or multidisciplinary treatment, physiotherapy or osteopathy, when I asked for referrals, they questioned whether I had endometriosis. So it wasn't even enough to have had the OR report. It's so bizarre, and it's so traumatizing for a patient to go through all those hoops in the medical system.
Yeah, I understand that the uterine tissue has spread to other parts of your body by then. Where was that, and what was happening to you because of that?
Well, my symptoms were, you mean my symptoms or just how it affected my lifestyle?
Well, how it affected your lifestyle, yeah.
Well, I had to change everything after my first surgery, from big things like my career to small things like my daily choices. So because it affects so much of your immune system and your whole body, I had to change my eating habits, so to lay off inflammatory foods like gluten. I had to change my daily routine and just adapt to my pace and just make sure that I always prioritize my well-being. I left academia because I couldn't reconcile the work that I wanted to do with the lifestyle I wanted to have. I couldn't have a balanced lifestyle. I had to keep moving from place to place to find jobs and apply for funding, and it was too stressful. And so I went into entrepreneurship, and being self-employed has really kind of saved my life because I could really decide what I'm gonna tackle, what I'm gonna say yes to, and really prioritize myself and learn that prioritizing yourself is not selfish. And often when pregnancy was offered as a choice and I didn't want to get pregnant, I felt so selfish that I just wanted pain relief and that I didn't want to have a child. So it's so complex. It's very hard for people to really understand the magnitude of what somebody with endometriosis deals with on a daily basis.
You created an online community for people with endometriosis. Why was that important for you?
It's important for two main reasons. One is that we really need to amplify voices to collectively change the standard of care. And this is not just a narrative that is in Montreal or Canada. It's worldwide. Like the diagnosis delays for endometriosis span somewhere between 8 to 12 years in most countries. And it's unacceptable. So we have to set the record straight to achieve a deeper understanding of patients' daily realities. And the second aspect is that this is a very, very lonely illness that's invisible, like you said in your introduction. So often people say, well, you look fine. Like, why are you calling in sick? And it's to break that isolation and to offer hope and to offer resources, not only to get diagnosed, but to then find the proper treatment, because there's so many misconceptions about what a proper treatment is, and then also to live with it because it can't be cured. So you have to manage it and find yourself again and learn to thrive with it despite the debilitating effect on your life. So the online community is really important for people to have a place to go when they're looking for care. I mean, we don't offer care, but we offer support. And behind the scenes, offline, I collaborate with organizations on initiatives to improve the standards of care so that we could really decrease diagnosis times.
Kristina, thank you for coming on the program and sharing your story for us. So it's called Alba, A New Dawn, correct?
Exactly. You could find it on Instagram, and I also wrote a book about my journey, a memoir that I'm looking to publish soon.
All right. Thank you for coming on this morning.
Thank you very much.
Kristina,
have a good day.
you too. Kristina Kasparian, she's a Montrealer with endometriosis. Joining us now is Dr. Richard Brown. He is the Director of Obstetrics and Maternal Fetal Medicine at the Royal Victoria Hospital. Dr. Brown, good morning.
Good morning.
What do you make of what you just heard from Kristina?
It's extremely unfortunate that it took so long for a solution to be dealt for her. It is unfortunate that there are delays that can lead to a diagnosis. Some of that, as you mentioned, is that initially seeing somebody can be problematic because symptoms are very common symptoms and not always associated with endometriosis. A lot of women have painful periods and therefore don't necessarily think that there's anything abnormal justifying seeking further care. And it's then a sort of progression of investigations, but it really should not take as long as that.
Yeah.
It's also unfortunate that she, in the end, had to go to Toronto because we do have the resources available to deal with that. Here it's not an area that I deal with in terms of the complex surgeries anymore, but I have 4 colleagues who tackle the sort of more complex endometriotic surgery. We have colleagues who are specialized in pain management associated with this. So the resources are available. It's unfortunate she wasn't able to be directed to those and had to go to Toronto to do that.
Do you think your field right now is well equipped to identify endometriosis?
Yes, I think we are. I think the delays, like I said, are for various reasons, because it's not necessarily always a simple diagnosis to make. So the mainstay is people presenting with symptoms and then being referred on. And the initial investigations, like she mentioned, may often not reveal the underlying problem. So ultrasound is the easiest investigation for us as gynecologists to access, but it'll only demonstrate endometriosis in people who have more significant components of the disease, what we call endometriomas, or cysts in the ovaries associated with endometriosis. Having plaques or surface endometriosis around the pelvis you may not necessarily see with ultrasound. So the next steps beyond that would be either to move to MRI or potentially to surgical investigation, to laparoscopy, where you're actually having a look inside the pelvis and you'd be able to visualize these areas and potentially treat them at the same time. And unfortunately for each of those steps, there's always a little bit of a delay, but it's not something that should be taking many years. It's something that should be able to move through much more quickly than that.
Right. Not every woman knows if their pain or symptoms are worth getting checked out. So what specifically should they be looking for if they're worried about this?
To some extent, it depends on the severity of the symptoms. I mean, it's also a very disparate disease in as much as you can have people with very significant, severe endometriosis who have fairly minimal symptoms, where it's found incidentally, for example, by people seeking investigations for infertility who don't have any other additional symptoms particularly. And conversely, you can have people who have pretty debilitating symptoms with what, when you investigate them, turns out to be actually fairly mild or minimal endometriosis that can be very easily treated, whose symptoms can then be resolved much more rapidly. So it's a very disparate condition, a disparate disease. And the spread of the symptoms is therefore very wide. So it's kind of beholden on people, if they're really in difficulty with what they're experiencing, to seek help and, escalate the investigation of those symptoms.
Yeah,
because it's not always the case that something will be found, because a lot of women have particularly heavy, painful periods where we do not find any evidence of endometriosis or adenomyosis, despite all the investigations appropriately being done. That makes it much more difficult to treat those symptoms in those people, and we treat them symptomatically. But you have to make the steps to pick up those things that are more significant, like endometriosis.
It sounds like they have to keep insisting, though.
I'm sorry?
It sounds like they have to keep insisting, though, to get someone to...
It shouldn't necessarily need to be insisting. I mean, if they present with the history of what their symptoms are, then it initiates that sort of progression of investigations and approaches to treating those symptoms. And sometimes if people's symptoms are relatively mild, suggestions for treatment will be initiated before some of those investigations take place to avoid delay in treating the symptoms. Because part of this is controlling the symptoms that people are experiencing. And although it's always nice to have a concrete answer to explain that, if you're going to wait a certain amount of time to be able to get an MRI done or to have a laparoscopy done, we will try and initiate safe and simple treatments before that to improve people's symptoms. And if they then improve, a lot of patients will be happy with that and won't necessarily want to take those next steps forward in terms of investigations because you've dealt with their presenting problem. But particularly in those people where things are a little bit more challenging to control, that progression forward of investigations to determine what's really going on is essential.
Okay. Dr. Brown, thank you for joining us this morning.